natural disasters and plane crashes, like when bodies are severely damaged, how do teeth help investigators identify the
There's
person?
a lot of changes in the temperature. Teeth are the only thing which remain.
Bite marks are one of the most dramatic aspects of foreign dentistry, often shown in crime shows.
It is a double-edged sword, actually.
Where do you see the biggest shift happening in dentistry in like nearly 5 to 10 years?
Biggest shift. People are
What is one truth about dentistry that people outside the profession rarely see?
outside the profession. People think that we only deal with teeth.
Hello everyone, welcome to my podcast, The Dental Lens. Today I am honored to welcome Dr. Divya Upala, a truly multidisciplinary force in dentistry. She is the head of Department of GITAM deemed university specializing in oral and maxillofacial pathology with an exceptional academic background including MBBS, LLB, MSc and FFO. Dr. Upala is not only advancing research in oral diseases but also pioneering the integration of forensic odontology and law into dental education, shaping how dentistry intersects with justice and diagnostics. Her work is a powerful blend of science, education, and innovation, and I'm excited to dive into her journey and insights today. Welcome, Dr. Divya. I'm truly honored to have you on the podcast today.
Hi, thank you so much for inviting me over. It's a pleasure to meet you and to speak.
Same here, ma'am. I was also waiting for the opportunity to speak to you. So, ma'am, you are an oral pathologist. Oral pathology itself is a fascinating field, but you have taken further into forensic odontology and even law. What first sparked your curiosity about the intersection between dentistry and justice?
Uh, I have a background in law, like my family members are in law. So I always had a uh, idea, a thought. My whole childhood went into in courts and stuff.
Oh,
So I think it was waiting for me to get into it. And justice is my. I like the concept of justice and the investigation part. So and the uh, and there's so many things which you can do with forensic. The application of law and forensic is quite intertwined. So I did law for that.
so was there a moment when you realized that your work in dentistry could impact much more than just clinical care?
Yeah. Uh, Dentist, I have taken oral pathology because I like the concept of research also and the finding the unknown aspect of it. So oral pathology deals with the unknown,
Yes.
finding out, diagnosing tumors. So that's how I got into this field, and I'm simply loving it.
What moment influenced you to choose this path, ma'am?
Oral pathology, yeah. It has a quite interesting stories. Like when I was in my third BDS, that's the time when we are introduced to the subject of oral pathology. We had a textbook, it was quite vast, and I didn't understand properly. So, and there are so many things to know. That's the first time you get to know that in dentistry you have more than
Yes.
just filling teeth. You get to know about diseases. You get to know how the process is, the disease process begins. So that's how I thought I should learn more about it. And it is an open field where it's the only field which connects medicine to dentistry.
Yes. I think when we study oral pathology, we get to know that there are so many diseases possible in life, and we should be so grateful
Yes,
that we don't have
yes.
any.
The gratitude that we are in this, we are good by
Yeah.
God's grace.
Like, and it is a subject where most answers are also asked in need,
Yes,
and
yes.
it is it's very deep and very fast. Like, if you really
Yeah,
get into it, then there is no stopping it. Like,
that's right. That's right.
so how did you start with forensic odontology? Forensic odontology feels like something out of a crime show. We just hear about it, but we never see it in practice. So, what is the reality, and how does dental science help solve real cases?
Um, to tell you the truth, this mystery crime is everybody loves a little bit of mystery in their lives.
Hmm.
So if I see back, the aspect of getting interested in forensic was there initially itself.
Hmm.
But I thought this is one field because I have done a background in law. I thought I should delve deeper into this field. That's how I joined this fellowship under Dr. Asita Acharya. It was quite, it was a good experience. I could learn so many things. Then it's definitely, I think everybody should go into this field if they're interested in mystery. And also, and recently there's a lot of work being done on this aspect. So this field is quite open for dentists now,
Yeah. And it
just
is
who have
very,
completed undergraduation BDs.
yes. And it is very underpenetrated also. Like when
Yes, yes.
we hear about it,
This,
but we never, I think this year for 1 or 2 persons who have come to know about forensic odontology.
yeah.
Ma'am, so what is, can you elaborate on your fellowship? Like if anyone wants to get into this field?
Yeah. There are a couple of courses in India where they do this. They offer MSc in Forensic Odontology,
Okay.
and what I have done is fellowship in Forensic Odontology, not masters. Earlier, masters was not accepted in India, um,
Yeah.
being done in India, but now MSc is being allowed, and then you can even go for PhD in government universities. And there are dentists who have, after BDS, they have done it in, they are doing their PhD in Gujarat University, where you have University of Forensic Sciences there. So in India, you can do it in DY Patil if you're interested in a fellowship. You can do it in SGM Harvard. And yeah, there are centers which are offering quite, you know, varied instances. You're getting jobs also under this.
So where do they get employed, ma'am? And how long is the fellowship or any course?
Generally, these fellowship courses are in a hybrid mode. Like
Okay.
you have a online mode for a couple of a week or so, and then you have classes throughout the whole year. You have even the field visit where you are required to be on the field for disaster victim identification. So that happens in the duration of 1 or 2 weeks when you are in. That's called as an in contact person uh, session. And but MSc and PhD definitely you have to be there. It's not like fellowship. Fellowship can be hybrid mode.
MSc is of 2 years or 3 years?
2 years, 2 years. Generally, it's 2 years.
And where do they get jobs after doing these courses?
Jobs nowadays, the crime branch, the government sector is asking for forensic people, and especially with people with a dental background because dentists have teeth are very important in forensic. So the teeth don't melt easily; they stay back. So that helps. So dentists have a very good role in identifying. So if they sharpen their skills in forensic, they are definitely taken up by the government sector. Yeah. And also private colleges also you can develop a wing in your college where you can be associated with the local
Yeah.
police station where you can help solve crimes there and you can be quite useful and well known to that
Okay.
uh, place locality.
Have you ever been part of a case where dentistry, played a role in justice or identifying victims?
Though not officially, but yes, I have given my expertise to few cases where there was underage child who was employed
Okay.
and a type of molestation case. So I cannot reveal more details of that thing
Yeah,
because
I understand. Yeah. I think every dentist should have basic legal awareness where they should, have this. What are the medical records needed to for a dentist if a dentist is approached by someone like trying to solve a case? What are the basic records every dentist should have of their patients so that it might
it's,
become useful?
it's a very important question. Thank you for bringing it up. Every dentist should have the records,
Mm.
not only having the records, taking the proper clinical records and maintaining them during and after. Please maintain the records. I will use your platform to tell people
Sure.
to preserve the records. At least they say for they can close the case, but they should have it for at least for 3 years with them to avoid any legal implications on them. That's the first point. Second is informed consent. It is better to have a written informed consent signed, though sometimes it's not practically possible, but in certain areas. But informed consent is mandatory. Seeing seeing so many cases around, informed consent is necessary, and also maintaining the record.
Ma'am, in these cases, like what information becomes crucial, like dental charts, X-rays, and how?
Yeah, you need the photographs, the clinical photographs, the X-rays, the treatment, the pre-visit, the post-visit, the treatment done in between, and of course the amount, the payment, what you have done. And if there is any way, suppose it's a denture, you're
Hmm.
providing a denture. If there's any way of creating a mark, or uh, because most of the forensic, this applies even in case of law, also like in forensic sciences, where if you need to track your, in India we lack the pre and post follow up from a dentist, because we have the market is not organized, the dental
Yes.
it's not organized, so we have to create a uh, proper record and communication between dentists. So when a patient goes from one dentist to the other, the records can be maintained online,
Mm-hmm.
and yeah, it can help the justice process also.
Bite marks are one of the most dramatic aspects of foreign industry, often shown in crime shows. So, in reality, how reliable is bite mark analysis in solving criminal cases?
Yeah. Bite, it is a double-edged sword actually. A bite mark can be useful, very useful. It depends on when the bite mark is, you get the bite mark. So if it is on an apple, it is different. Whereas if it's on, if the bite mark is on skin, it's different.
Okay.
So the skin tends to shrink. If there'll be inflammatory reaction. So as soon as possible, the bite mark should be photographed. Photograph also should not just be without any scale. There should be a proper, at least a scale, always a scale beside a bite mark to take a for, to even apply it as a evidence. So, and uh, so there are many studies where they study the bite mark on fruits and vegetables and all, but actually proper skin interpretation is necessary, because skin always shrinks. So, but once it is correlated, it can be very helpful.
Okay. Are dentists trained for this in India? How to preserve bite marks?
No, right now it is only upon the interest. Of course, we have one or two chapters on it on the in the main textbook, but
Yeah.
it is not followed as such. But we need to make it
Yeah. And
more.
how do we preserve them? If anyone wants to preserve the bite marks.
Yeah, preservation as such is mainly clinical photography method. So you have to take a photograph,
Okay.
photograph with the help of a ABFO scale. It is
Mm-hmm.
American Board of Forensic Odontology scale. It's a L-shaped marker thing. If you have that in your department, that's very good. Or if not, you can just place a measuring scale just beside that lesion, that mark,
Mm-hmm.
and you can take a picture.
Okay.
That is the ideal way. Of course, you can make casts out of it and all that, but that will all show changes, secondary changes later on.
Do you think like intraoral scanners with increased digital dentistry, it is easier to preserve the bite marks? Because we're already
Intra,
scanning the occlusion, right?
yeah, that is from the assault side of thing. Like it can aid in making the for an intraoral scanner. I think you just get the cusps and the
Hmm.
shape of it. But we need the depth of penetration. I think yes, we can use it as an adjunct, but not as a preliminary. For the main evidence, we need definitely the casts of the patient, of the person who has committed the crime. So that's how you're going to place it on the bite mark and assess
Hmm.
which are the cusps and tips which are going to be correlating with the mark.
And how about age estimation, ma'am?
Yeah, age estimation, you have numerous methods, and the most frequently done nowadays with X-rays, they are done actually with
Okay.
OPGs. That's the most reliable. Uh, it has its own faults, but it is used widely
Okay.
in India.
So, what are the changes that we see? Like, what dental structures change with age?
These dental structures, generally we have the pulp tooth ratio, the amount of mm, wisdom tooth development,
Yeah.
the apex closure, that it's mainly dealing with patients below 18 and above 18. So these structures help with identification.
But I think they just give a range. We cannot estimate.
Yeah, we give a range, we give a range. And there are probabilities, statistical probabilities. Of course, there is always a margin of error, and we have to compare it with our medical fraternity
Mhm.
because they use the thigh bone and the femur bone and the
Yeah.
wrist. So
Yeah.
those are considered a little bit more appropriate
Okay.
compared to the teeth. The teeth can act as a adjunct to it when no other part is available. Then you can go for the teeth.
Okay. I mean, natural disasters or in plane crashes, like when bodies are severely damaged or decomposed, how do teeth help investigators identify the person?
Yeah, in plane crashes and where there is a lot of changes in the temperature, with the
Hmm.
high temperature, the teeth are the only thing which remain.
Yes.
So either, but they become very brittle.
Okay.
So the handling of that specimen, the teeth,
Hmm.
it should be very very careful. Like it can break, it can be very brittle.
Okay.
So they help in identifying. Like you can do. There's so many procedures about it, and you have to be particularly trained for this disaster victim identification.
Okay. So in these courses, do they train you for this one also?
Yeah, you have to get trained for this disaster victim. A specialized team is created only after you have passed a certain amount of cases and training.
Like how legally aware are dentists about the risk and responsibilities involved in clinical practice?
Uh, Earlier, when I started my work, they were not that aware.
Okay.
But nowadays, it is becoming better. There's more awareness among dentists. But
Mm.
still, there are certain cases of malpractices and, both sides, the patient and the, mistakes done by dentists. So awareness is there, but it has to improve,
Okay.
definitely.
They don't know how to apply it, I would say.
They don't know how to apply it.
So, what are the most common legal mistakes dentists make?
Non-documentation.
Hmm.
Non-documentation and not taking proper history.
What should every dentist always document in patient's record?
Uh, Always document the past history, medical history,
Hmm.
present clinical history, and medications. Medications. You have to check whether your medications, what is he on, whether he's on any aspirin or whether he is on any other type of drug which are causing interaction.
Hmm.
Many just don't think that it is necessary to know because the patients sometimes don't tell their true history. True.
Okay.
Then after the treatment, they might say, "Oh yes, I was taking just sugar tablet or some type of platelet tablet. It doesn't affect anything, but then it might you might be in the midst of doing a major extraction also.
Hmm.
So you have to be uh, you have to be keen and little curious
Hmm.
about what the patient is saying.
Yes. I think patients underestimate the relation between their health
Yes,
and teeth.
that's right.
That's why, they're like, if I say something, they will ask us not to do and come back later. So I'll just
Yes.
hide it and get it done. Actually, it
Yes.
happened in a clinic where I was working. The patient had hepatitis,
Oh.
and she did not reveal it to it. So all the staff was set to get, get the vaccination, get it. The instruments were thrown. So the clinician asked her, "Do you have any problem? Do you have no, nothing, nothing, nothing." After the examination, after everything, feeling that, yeah, I had hepatitis. I think it is hepatitis much more. It is kind of communicable disease, and it is much more worse than having sugar or BP and.
Yes, yes,
I
yes.
think we have to have the protocols if the patient says it or not even then. Ma'am, in legal cases involving dentists, how often does the issue come down to poor communication rather than poor treatment?
Poor communication is the most important aspect,
Hmm.
because I don't think dentists can be so poorly trained. The whole thing is about poor communication. If you can communicate well, the first is the patient. The management of the patient, making him or her tell you the complete history,
Hmm.
and to be cooperative ultimately. And yes, so communication is very, very important, most important.
Ma'am, what does proper informed consent actually look like? I think we just take the sign on prescription or the OP card. So is it enough or we need something?
No, 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 no. That is not enough. You have to have a separate sheet which says exactly in patient's language, like whatever in the local language, in the language which he or she can understand, not in our gibberish dental terms and difficult terms. No, it has to be in the patient's language, and if it's a adult, it's okay. But if it's a child you're treating, then the guardian has to be able to give consent on behalf of the child, and you have to explain exactly what you're doing to the patient,
Hmm.
and uh, what could be the effects of it, if any, and then take the signature.
How do dentists, minimize their legal risk, with the rise of media and all? Earlier, the cases were not unheard of. They
Mm.
were very rare. But these days, the cases are becoming rampant on the dentist. So, how do they protect themselves without compromising patient care?
Informed consent, consent and documentation. You have to be careful, and it's better not to run behind patients, uh, and wait for a proper patient, uh,
Okay.
because sometimes there's a lot of competition and people
Yeah.
can go a little bit.
Yeah. Many dentists now share cases on social media for educational or marketing purposes before and after. So, what legal precautions should they keep in mind?
Please always blind the face, and the eyes, especially. We are not supposed to show the patient's face in public without the knowledge of the patient. If it is out on a public platform, the patient can definitely sue you. You have to blur the face as much as possible. If at all, you have to show the uh, patient's work, the work you have done on the patient.
Ma'am, do you believe legal literacy should become a mandatory part of dental education?
Yes, I highly believe that every dentist should learn the basics of our justice system, if any justice system in the world.
Especially how to defend themselves if anything
Yes, yes,
comes up. Yeah. Ma'am, apart from this forensic and law, you are also very much invested in oral cancer research and
yes,
oral
yes.
cancer screening. So, oral cancer remains one of the biggest public health challenge in dentistry. So, where do you think the biggest gap lies today? Awareness, screening, or education?
Oh, that's an interesting and widely discussed question, actually. We have been discussing from decades. So we have awareness, but the point lies in the connection between, people know it by the mind, but they
Hmm.
don't know it by the heart. Nobody believes that it can come to them, even
Yeah.
if they, unless it comes to them. So you, the awareness should be better. The screening can be better. The treatment is always good because it's a treatment. Awareness and screening, yes, it can be definitely better.
So, what role can general dentists play in early detection of cancers?
First, educate yourself properly on the various signs of oral cancer,
Hmm.
especially pre-cancer. Let's not doubt. Let's doubt ulcer, a non-healing ulcer. Let's doubt growth. Let's doubt unhealed extraction socket. Go ask yourself a bit. So ask yourself what is the reason behind it. Ask the clinical history of the patient,
Hmm.
and be a little suspicious when you see. Be a little bit of a mystery. It's a mystery. Mouth is a mystery.
Yes. So, ma'am, like pre-cancer sessions, the most common thing is leukoplakia and white lines, lichen planus, and all. Apart from these, what are the other signs that we should be aware of while checking the patient's mouth?
Yeah, you have to check for any. First, you have to know the normal. That's how you get to understand what is abnormal. So train your eyes for the normal stuff.
Okay.
The pink oral pink skin of the mucosa, that's normal. The stippling present on the gingival mucosa, that's normal. The the anatomy of the tonsillar fosses, the
Hmm.
parietal rugae, the texture of it, that should be normal. The consistency, the fair, So any deviation from these normal structures, you have to doubt. Like a growth on the gingiva. It can be benign, it can be malignant also. So you have to know your differentials a little bit. You have to make a list of differential diagnosis. That's always mandatory
Okay.
before we give it for a biopsy.
Okay. Ma'am, how do we detect cancers in the mandible? Are there any signs, if there is no growth, only the cancer is there? So,
Yeah.
apart from OPG, can we
Yes, yes.
able?
That's a nice question, actually. Good you brought it up. So we have seen so many cases where the cancer is inside the bone and outside the bone. So
Hmm.
if you have a cancer inside the bone, intraosseous commissile carcinoma, if you have cancer outside the bone, it can be primary or secondary.
Okay.
So if you have to see it from the OPG, you can see the ragged borders of uh, the borders will not be uniform and then be ragged.
Okay.
And you can see a lot of bone loss. And the patient can sometimes give a history of paresthesia, a lot of pain uh, in such circumstances. And sometimes that carcinoma can also come out of the extractive socket also.
Okay.
So you have to be a little careful.
So,
We
are there?
saw a case recently where
Hmm.
there was a lady who had a broken third molar.
Okay.
This case was brought by her nephew,
Okay.
and the nephew was a dentist, and he never thought that. Uh, he just gave the tissue along with the third molar, the broken root stump,
Hmm.
and there was slight radiolucency around the third molar. We just saw that it could be a granulation tissue, but
Hmm.
to our uh, amazement and surprise, we could see a lot of keratin pearls and inflammatory cells. And it just turned out to be that the patient didn't back to the dentist after her tooth broke.
Hmm.
And it was a place of chronic trauma in that area. So
Okay.
that resulted in this commissile carcinoma for this patient. It's quite unfortunate.
Ma'am, if every general dentist could adopt just one habit to improve early oral cancer detection, what would you want? What would you want that to be?
For detection,
Yes.
yes. Screening,
Hmm.
please ask the patient to come for a mandatory, like when you have this program where they say it's every 6 months you have to go to a dentist
Hmm.
for your cavity protection. Make it like a plus add-on for checking up your oral mucosa also, oral cavity for oral cancer screening.
Ma'am, you say you are HOD in GITAM University. It's a very well-known university, and I'm sure like you have mentored many students. And recently, you published like a pro for MDS students.
Yeah.
What motivated you to write a guide specifically for young researchers?
Yeah. Actually, that book is actually it was a baby project of mine because when I was studying, I didn't have anybody to guide me how to publish. My first paper came out only after I passed out,
Okay.
so I never knew what to do
Hmm.
uh, because we didn't have internet access or that much of knowledge that time.
Hmm.
So I thought everybody should have the basic knowledge of what can be done when we want to publish our work. So that book acts as a guide for students.
Why do so many postgraduates never have published papers? They do the thesis, but those papers are never converted into publish.
It's a lack of the awareness that, I push my postgraduates for publication because that directly reflects what their work, what they have done during their postgraduate days, and it would it'll be helpful for the future. That the places where they work, they will get to see whatever work they were being in, and what is their capacity. So the students are young. They will focus only on their remarks and passing out at that time. So they
Yeah.
don't think that they have to have a publication or do some research work, which if you have greatly boosts their employment chances and even their knowledge, their experience also.
So, what is the one mistake you repeatedly see in academic writing?
One mistake in the sense, like from the students.
Students.
Yeah, students have to be I will not blame the students completely. We have to make them more motivated. They have to look into patients. They have to look into cases. Use every time to upgrade yourself during the coursework. Try to study. Try to, because once the best time to improve yourself is during those 2, 3, 4 years you get during your education. Once that time is over, you won't have the motivation to go back and read it, read it or analyze it. So use your time of academic time for academic activity. Of course, fun aspect is always there.
When one of your students publishes a first paper or finds confidence in research, what does that moment mean to you as a mentor?
I try to see myself in that student. The student's happiness
Yeah.
it just tells a lot about. It gives a satisfaction that yes, they don't know about it till their name is out on a paper. So
Mm.
once it's out on a paper, that's the moment they realize, yes, it gives them a lot of confidence in their lives. And I like it. That's my job.
What is one truth about dentistry that people outside the profession rarely see?
Outside the profession, people think that we only deal with teeth, and teeth are just, teeth. But
Yes.
there's so much of hard work which goes on to analyze, study, know the system, biology. There's so much of process during, before birth, in life, and after that.
Hmm.
It that deals a whole spectrum of histology, pathology, and forensic. So there's so much of thing we have to train ourselves, and it's a continuous process. But people outside just think, oh yeah, just a filling, just put some restoration, and that's it. That's not so easy.
Yeah. And there's a popular question: what do you study for 5 years for 32 teeth?
Yes, that's a
Yeah.
famous question. Yeah.
In India, it is so easily they just do away with the profession unless and until they have pain they don't realize it.
Yes, dental pain is the worst pain actually.
Ma'am, where do you see the biggest shift happening in dentistry in like nearly 5 to 10 years?
Biggest shift. People are more interested now in the other aspects, like we have artificial intelligence. AI is coming up a lot. So there's a lot of research happening in cancer research and the application of AI in it.
Hmm.
Me myself, I'm working on artificial intelligence on
Oh,
this on cancer.
okay.
Uh,
Please elaborate on this, ma'am. Like, what are you working on?
yeah, I'm working on multimodal AI on cancer
Like,
thing. Like A patient generally, we give a report
Hmm.
saying the histopathology, history, and then we give a prognosis to a certain extent. So me and my team thought, like, what if we give a more detailed explanation about the prognosis of the patient based on the different modes of media we have available, right?
Okay.
We have the clinical records, we have
Hmm.
the histopathology, we have the radiographs, we have the immunohistochemistry for some cases. So why don't we create a multimodal AI system
Hmm.
where we can assess and give the prognosis to the patient, which will be helpful because
Hmm.
unidirectional one mode of diagnosis, yes, it's always there. But if we can, integrate all these systems, how would
Yes.
it? That was the concept behind it. So
Hmm.
it's right now gone for copyright, and we're working on the patent fast.
Okay. So basically, when you feed it the information, it is educating the patient about their prognosis.
Yes. Yes.
I think it is very important for even for the awareness part of
Yes.
oral
It can
cancer.
be used for other aspects also.
Yes. Ma'am, like I've heard about AIs like Muskan AI and one more, the name escapes me. But they are claiming that they can detect cancer just by a photograph. Is it possible?
Um, all those systems are there. I will not say, even a chat GPT and everything, you have such stuff which it can tell you, but I will not say that it will replace a oral pathologist.
No.
They can be used as an adjunct. They work to with some, margin of error.
Okay.
You have to always keep a margin of error when you deal with these
Mm.
apps, with this AIs. It's not yet future. It's not yet 100% proof.
Hmm.
No, never, not yet.
It can be easier for like I actually did a webinar on AI in
Mm,
prosthodontics and
mm,
I covered all the aspects that AI is
mm,
helping from the
mm,
scanning to the production. So during that research, I got to know about Muskan AI, where they are saying that if we take a photo and send it to the, like if we take a photo, the AI will detect it, and if there is a possibility of cancer, then it will send it to the dentist and also the patient, so that they can uh,
yes.
go
See,
on it further.
here the concept of a third party has come. Like dentist is there, a
Yeah,
pathologist is there in the loop. So
yeah.
once that is there, yes,
Because oral cancers are more diagnosed in rural India, and in
yes, yes,
rural India, dentists are very less. So I think if,
yes,
but the challenge is they should get the awareness of taking a photo and sending
yes. So,
the. So I think if we can do it in the in community centers and all where
yeah,
that, then they can be sent to a cancer research hospital or somewhere to get an
that's
early.
right.
I think
That's right.
it will be beneficial in the future. And what new opportunities should young dentists start preparing for now?
In as you said, there there are so many dentists in the city.
Hmm.
We should tap in the rural aspect. We should tap in the places where there is prevalence of oral cancer uh, in the forensic part. So these areas are still untapped, and there's a lot of potential where we can connect the areas.
Ma'am, if a young dentist is listening right now, who is in undergrad or just passed out, how do they start? Like we have covered MSc and all, but what is the first step they need to take? How do they assess even if forensic odontology is for them?
Interest? Are
Hmm.
they interested to to know more about what is beyond?
Yes.
What happens? It's all based on interest. You have interest, sky is the limit. You can do so much of work on it, but for that you have to first read,
Hmm.
learn, be curious, be always curious. Why? Ask yourself questions. Why? That's the basic requirement to
Hmm.
grow.
Ma'am, one book or habit or a mindset change that changed your career.
One book or habit? Yeah, habit. I know. Yes. Uh, I don't know how far, but yes, it has helped me to get up early in the morning.
Okay.
3 to 4. That's the time I felt like, getting up and reading, studying, it's just the best part of a day is that time. So if you're a student, I think you should use that hour to
Mm.
uh, improve your my mental clarity.
Yeah.
That habit helped me.
Yeah, I mean the world is sleeping. Nobody needs you at that time,
Yes.
and especially as mothers and family purpose
Yes.
people. I think, but again, we have to sacrifice our sleep for that.
I think as you grow older, your sleep also reduces. Or if you're highly motivated.
Yeah.
Yeah.
Would you recommend any book to start this journey on, or in general, any book that had an impact on you?
A book, The Alchemist. The
Okay,
Alchemist is my go-to book for motivation.
okay. That's fine. When it released, it was such a hype. But unfortunately, I didn't. I bought the book, but still I couldn't find time to read it. I think.
Please do read. It's wonderful. And there's one more book called A Thousand Splendid Suns.
Yeah, that one I read.
So
Any.
that's a good book too.
Yeah.
So
I think the Kite Runner is the best book that I've ever
Kite
read.
Runner, yeah.
That is the one book that I read at least 5 to 7 times, and
Mm.
still I get goosebumps reading that book. Like it had the most fiction one is the most.
Yes, Kite Runner, yeah.
Ma'am,
Okay.
what
Mm.
is one legacy you want to leave in dentistry? Like, if any students or colleagues talk about your work, what impact would you hope they remember?
They should at least remember that she tried her best. She in endurance, persistence, and you can do it. She tried. You have to
Yes.
try the best and not think about the ending.
Thank you, ma'am. It was such an eye-opening episode on various things like forensic odontology, law, and also oral cancers and all. Ma'am, if you had to give one advice to your younger self, what would it be?
Don't be scared. I was very scared. Don't be scared. Be more bold. Be more. She would have been more curious than this. And don't fear. Don't fear is the word.
Hmm. I think it's the same thing. Don't be scared or don't get
Yeah.
fear. But I think, yeah, like don't be scared to start any new thing or dwell into a new
Yes,
field. Whether if there is no path, you can create your own path in that field too.
that's true.
Thank you, ma'am. Thank you so much for your time and such a thing. Maybe we will do another session regarding all the endeavors that you are doing. It is, I think, each thing needs their special episode.
So,
I,
thank you
I,
so much for your efforts.
thank
You
you, ma'am.
have motivated me in so many ways. Thank you so much.
Oh, thank you, ma'am. I hope to have at least a tiny bit of impact. But saying that, thank you so much.
Yeah. Awesome, awesome. Thank you so much.